Mental health encompasses emotional and psychological well-being. It enables us to cope with the ups and downs of everyday life, get up in the morning, contribute to society, learn, share, and much more. It's what let us ride out difficult times and flourish. According to Health Canada, 11% of men and 16% of women will experience major depression in the course of their life. Experiencing sadness when a loved one has passed or feelings of discouragement when life gets tough is part of being human. We generally manage to make it through situations such as these. This is known as minor depression. The difference between minor and major depression is the severity and persistence of the feelings of sadness over time. Everyday activities such as showering, eating, or paying bills become difficult to accomplish. Symptoms may include a loss of interest or pleasure in activities that you normally enjoy, feelings of guilt or low self-worth, dark thoughts such as thoughts of suicide, difficulty sleeping, loss of appetite, and a lack of energy are often added to the mix. Cognitive issues such as trouble concentrating and memory problems can also occur. There are a variety of causes linked to depression, and they can vary from one person to the next. Here are just a few. Significant events such as the loss of a job or periods of intense stress or illness, family history, hormonal changes during menopause, for example. Depression can increase the risk of developing certain diseases. This includes conditions affecting the heart and blood vessels, such as heart attacks and strokes. It includes conditions that affect brain function, such as Alzheimer's disease. That's why it's so important to treat depression, improve mental health, and reduce the risk of physical health problems associated with depression. Studies have linked depression to neurocognitive disorders. These studies show that people who have experienced a depressive episode have a higher risk of developing a neurocognitive disorder than those who have not. We still don't fully understand the link between depression and Alzheimer's disease. However, researchers have suggested some possible explanations. Here are a few. Depression may contribute to the development of Alzheimer's disease because it alters brain function. People experiencing major depression may change their lifestyle habits by, for example, ceasing exercise, eating poorly, or withdrawing socially from others. These factors are linked to an increased risk of developing neurocognitive disorders. Depression may be one of the first signs of Alzheimer's disease. Depression and Alzheimer's disease may have common causes. For example, the same genes may play a role in both conditions. Treating depression also reduces the risk of developing neurocognitive disorders and other health problems. If you think you're suffering from depression, ask for help and see a healthcare professional like your family doctor. Receiving an accurate diagnosis and drawing up a suitable treatment plan are among the essential steps in effectively treating depression. There are several strategies for treating depression. Here are some of the most commonly used approaches: treatments, medication and psychotherapy, stress management techniques, methods such as relaxation techniques, meditation and deep breathing, healthy lifestyle habits, a balanced diet, restful sleep, and regular physical activity. Every person is unique. What works well for one person might work poorly or not at all for someone else. You might need to explore different treatment options to find the one that's right for you.